One of the things around the business case for asthma community health workers is their cost, right? They're cheaper than often other healthcare providers. And I think but it's important to talk about them that they're not just solo practitioners. They're part of the healthcare team. They're integrated with supervision from an asthma nurse educator, and they're really being able to be integrated to part of what I'm delivering. And so when we think about kind of the hiring plan, sometimes that asthma community health worker can be an employee of the hospital. That's how we do it. Sometimes it can be a partnership with a social service agency, like we would do, say, a visiting nurse, where we would partner with both the visiting nurse and the asthma community health worker. And I also think that there are public health funding streams, right, where a community health worker may be part of the public health department. And I think that it's really important to think about them as both a cost-effective use of resources and then also as part of the healthcare team itself. One of the things that's really important to keep in mind is that for us to be the most efficient healthcare system, we have to work to the top of our license. It's not a good use of my time to sit down, not only to give the asthma action plan, but spend a lot of time being able to teach it. And one of the things that I love about the asthma community health worker model is that I'll come up with the asthma action plan, I'll negotiate it with the patient, and then they'll go into the home and actually spend time talking about how are you going to do this? What does it mean when your kid is sick to go up to the yellow zone and be able to use your rescue medicine along with your controller medicine? Making that plan a reality, so it's a real plan, it's part of every day, I think is something that really a community health worker has the capacity to do that I don't.